Welcome back. I'm Kellie Davis, and we are here speaking with Dr. Hanna, and we're talking now about surgeries for weight loss. So what kind of surgeries are out there for weight loss?
Well, there's several different kinds of surgeries for weight loss. The most traditional, or the one we've been doing the longest and still considered the gold standard, is the gastric bypass. There's the gastric banding. There's a somewhat newer procedure which is becoming more popular called the sleeve gastrectomy.
The sleeve
gastrectomy.
Okay.
And then there's a little bit more radical surgery that I don't actually do called the biliopancreatic diversion.
I have to say that. The biliopancreatic diversion. BPD.
I
like that one, BPD.
And there's variations on that surgery as well. The three surgeries I do, like I said, are the gastric bypass, the sleeve gastrectomy, and gastric banding.
Okay. Gastric bypass is the one where
So in the gastric bypass, we basically staple and divide the stomach, creating a very small stomach, about the size of a golf ball. We take the pipes, we divide them, we bring up one pipe, hook it into that little stomach, and then connect the pipes farther down. So basically you're creating a very small stomach, so you eat little. You're also creating a diversion, that's the bypass part, where food travels for a period of time not getting digested until further down when it connects to the juices that come from the liver and the pancreas that help you break down and absorb your food. So you eat less, you absorb less. It's basically how it works.
Now, and then you said one with the gastro, one with the band, would say
there's
that one?
There's the gastric bypass, which we just talked about. Then there's the sleeve gastrectomy, which is basically we take out about 7/8 of the stomach, creating a long, skinny sleeve. Okay.
Is that are you referring to the stomach as a sleeve, you mean?
What we leave behind looks like a sleeve. Okay, it's a long, skinny, about the size of a banana. Yeah, so it greatly decreases the size of the stomach. So that's the restriction part. And then it also takes out the part of the stomach that produces a hormone that makes you feel hungry. So their hunger goes way down because we're getting rid of a lot of that hunger hormone.
It's interesting because I watched a show once, and this woman, I believe she had the gastro bypass surgery, and one of the things she felt after she had it, she did lose the weight and everything, but she talked about the joy of eating. She used to really like to eat, and that had kind of gone away. Was that atypical, or do you find that?
No, that's fairly typical. There's a lot of psychological aspects both into, having the disease of obesity. We know that people who are an unhealthy weight, that there's a high prevalence of childhood trauma. So there's a certain aspect that goes into that. We also know that there's other eating disorders besides the one that we commonly know about, anorexia and bulimia. There's also binge eating disorder, night eating syndrome, hormonal eating. And those are all issues going into the surgery that don't necessarily go away with having surgery. So yes, while we greatly decrease the ability to eat a lot, what we don't decrease is that desire to eat a lot. And some people struggle with that. If eating is sort of a coping mechanism, they now have to find a different type of coping mechanism.
So they were coming to you, and I don't know if the right word is evaluate. How do you know
evaluate them for?
Yes, they have these kind of pre-existing mental issues around it.
Yeah, part of the process of preparing to have surgery for weight loss is we do require them to see a mental health provider. We also encourage them to continue to get counseling both before and after surgery, whether that be through a mental health provider. We also provide support groups so that people who've had surgery or are thinking about having surgery can get together as a group, talk about a lot of these issues, talk a lot about the coping mechanisms and other aspects of having surgery.
This is also another question that I have had I have some of these celebrity types, you've heard that they've had this particular, the gastro bypass in particular, and you see them, they lose all of this weight, and then you see them maybe a year later, and they're kind of going back up to a heavier size. So it's not an end-all, be-all.
No.
I don't know if someone's going to have the surgery. I guess this is the question. How can they prevent that from happening?
Right. There is, unfortunately, about 10 to 15% of people who have this surgery who regain a lot of their weight back. Everybody regains a little, but some people do regain a lot back. And that's where we stress that this is a lifelong commitment. Things that we know that make people more successful with this surgery is that they continue to count their calories, they continue to monitor how much protein they're getting, they continue to exercise, and they continue to go to support groups, and not just for the first year or two, but for the rest of their life.
And the surgery is safe, would you say?
Surgery is becoming safer and safer. It's certainly safer than it was 20, 30 years ago. But surgery for weight loss is as safe as having your gallbladder out or having a hip replacement. So it's in the, while surgery is never 100% safe, it's certainly in one of the safer surgeries.
And is there been a case like someone comes to you and has the bypass surgery, and then they want to come and have like they are one of those people that gain that weight back, and they come to you, and what do you say to them?
Well, there's a long program for weight regain. After we do an initial evaluation, we check their laboratory values, we get them back into what we call the program, meeting with my dietitian, going through their diet, we get them back into the support groups, we look at their exercise level, we look at all the behavioral aspects to weight regain, and then we evaluate their anatomy. I haven't had any of my own patients come back with weight regain, but I've had them come from others so far. But I've had them from other surgeons. So we end up, doing tests and x-rays to see if their pouch is small enough, to see if they've had, their anatomy is appropriate.
So does surgery make weight loss easy?
It makes it easier. It takes a lot of that hunger and that starving feeling away after surgery, and makes it easier to lose weight. But it's still a lot of hard work. You still need to make sure you're getting enough protein. You still need to monitor your calories. You still need to come to support groups, and exercise is a huge key. So sometimes I feel that people are looking for that magic pill, that surgery, and then they'll magically lose the weight. There's still a lot of effort required to achieve a healthy weight even after surgery, and we do a lot of preparation. This is not one of those things you come in and say, I have a hernia, and in 2 weeks you're booked for surgery. There's a lot of education that goes into it. They meet with a dietitian multiple times. We do all those normal medical evaluations that are required, but we do everything possible to make sure that everyone has the right tools to be successful after surgery.
Okay, well, thank you, Dr. Hanna, and we're going to be right back right after this.